infrastructures. So on this slide, I really wanted to just kind of define what we mean by infrastructure. And these are the sort of underlying facilities that an organization or a system or a country has. So it's the basic things you need to run any of your things. And infrastructures can be visible or invisible, and sometimes they're everywhere and you just don't notice them. So I don't know if anybody knows what the road system is on the top left. This is perhaps showing my age. It's Spaghetti Junction, and it's around about Birmingham, and it's something that we used to kind of laugh about when I was a child. And in a way, it's a really complicated road system. It's necessary to get people around Birmingham, but sometimes it seems so complex you feel that you could just get lost on it. And that's sometimes a little bit what infrastructures can feel like. And on the right, I've just got a picture of a grid there. And really, I put that there because, you know, we know that we've got sewage systems and water systems, you know, in the country, but a lot of it's invisible, but we need it to kind of run our society. Well, with research, it's a similar sort of thing. Research infrastructure refers to the facilities and the resources that you need to generate the evidence that's required to inform and for here today, health and social care. So sometimes, is that somebody asking a question? No. So sometimes it looks complicated, sometimes it looks invisible, but essentially it's a necessary thing that you need just to make things run. And on this slide, what I've done is I've showed you what's called a research or innovation roadmap. And an innovation is just a new idea or a new tool or a new method of doing things. And research is sometimes focused on trying to understand what these new things are and whether they're really of any use. And sometimes you've got people at a very early stage of research, they're inventing things. These are prototypes or they're ideas that can be invented in a lab. And it takes a long time for those things to be researched properly so that we know that they're safe, so that they can be used within the NHS or within social care. And I think the easiest way to explain that is at the beginning of the COVID pandemic, a lot of people were trying to understand what the COVID virus was and trying to develop vaccines and therapeutics. But it took a long time for people to do all that work, is to actually get the prototype vaccines ready and then to test them on very small groups and then larger and larger groups so that we knew that they were safe enough to roll out across society. And then we had to decide how to get them administered and rolled out through a network of services in the NHS. And a lot of research follows the same sort of process from the original invention or idea or discovery through to testing things out in the real world and then trying to get them taken up by doctors and nurses and social workers and other people who need to use those technologies for patient benefit. And these infrastructures that we're going to focus on, they sit all the way along this research or innovation sort of roadmap. And it's sometimes called the translational pathway. So the rectangles in purple, I'm going to go through some of these acronyms and explain each one of them. But what I wanted to do for you here on this roadmap is just basically say that they sit at different stages along what we call this translational pathway. And at the bottom, you can see these hexagons, which are often used by people who are closer to business. These are the people who might be developing prototypes, maybe people from the pharmaceutical industry or other businesses thinking about developing apps. And they're looking at it initially from the perspective of their business or commercial enterprise, but they also need to follow a series of steps to make sure that their gizmos and their tools and their objects are appropriate to be used within the health and social care sort of system. So if you keep an idea of this roadmap in your head, it's quite hard, and then we'll try and work through these infrastructures. And I've taken the approach of trying to work broadly alphabetically, and that was quite nice because we could begin with the ARC or the Applied Research Collaboration, and that's the one that Felicity and Jane and I are all involved in, and so we know most about that one. So I'll work broadly alphabetically, but there's a couple of places where my system slips up, and I'll explain myself when we get there. So what is the Applied Research Collaboration? Well, firstly, how many are there? There's 15 of these ARCs all across England, and our ARC is at the very top of this diagram in orange, and we cover the whole of the northeast and North Cumbria. So you can see from that they're sort of regional structures. Each of those 15 ARCs were given £9 million over 5 years, and they are designated, contracted to run until 2024. All of the ARCs, when they were trying to be designated, they were asked to find matched funding from their health and social care system. And when our ARC was accredited, we had £6.9 million of matched funding from our colleagues in the health and social care and voluntary sector organisations. Our ARC links 6 universities up with all bits of the NHS and the wider care system. So that includes local authorities, public health, social care, as well as primary care, the voluntary sector and community organisations. And the vision of our ARC is to try to achieve through research better, fairer health and care at all ages and in all places. And I've got the 6 partner universities that were linked into the ARC for the North East and North Cumbria. And what do ARCs do? Well, we are funded to do research, but that's research on the things that are a priority for our region. And the kind of research work we do is meant to be very practical, real world research that's available in quite a timely fashion, providing the evidence when it's needed, but also in quite a simple form. So it's most usable by the people who need to have that evidence to their fingertips. Part of our role is to increase capacity. So it's to train scientists to do this kind of practical real world research in the future. The remit also covers providing research training to practitioners and to public members and to all the people who might want to have a better understanding of research methods or indeed research infrastructures like we're talking about today. Part of what the ARCs do is to take the evidence and what we already know and try and put that into a form so that it's easily usable by the people who need to base their decisions about what we do in the NHS or in social care or the voluntary sector system. Where people are making those decisions in the real world about changing models of care, bringing in new types of practitioners, part of the ARC work is to evaluate that, to see whether these ideas and these decisions actually lead to any benefit for people and communities around the region. And as part of our work, we're committed to engaging and involving members of the public in everything that we do. And in our ARC, we've got 7 research themes. This is a fairly busy slide, but my point in showing you our themes is to show that we focus right from preventing illnesses through to treatment and care and to integrating health systems. We're committed to trying to address inequalities, to dealing with children and families as well as older people in the population, and to be taking evidence and trying to put it into practical form so it's really useful for people, and to be developing new methods and skills to do that one. And these 7 things are the priorities that were identified after a process of talking to lots of people across the region about what we should focus on within our ARC. So moving to a different kind of science, and this is almost at the opposite end of that pathway that I mentioned. We have a biomedical research centre in the region. The Biomedical Research Centre essentially is funded to the tune of £16 million. And it's a partnership between one hospital trust and essentially one university, and that's Newcastle University. So you can see that there's a difference in the amount of funding that is available to different kinds of infrastructures. And our Biomedical Research Centre in Newcastle is one of a number of BRCs that are across England. And this shows all of the other BRCs on a map. There's 20 of them. They're funded through a national competition like an ARC, and they all involve university partners linking to trusts and doing much more discovery science, trying to get ideas from a laboratory and closer down that pathway into clinical practice. And RBRC has a very specific focus on improving lives through world-class research in aging and long-term conditions. So it's very much focused on the later end of the life course, and you can see some of its priority areas on this slide. So moving along, we also have in the region what's called the Blood and Transplant Research Unit. This is a partnership between Newcastle University and Cambridge University. It involves about £5 million worth of funding up until 2022. And this is to focus on world-class transplant research. And what this unit is trying to do is to think about new approaches and technologies that will actually help increase the availability of suitable donor organs for transplantation, but also trying to improve the viability and the survival of transplants when they've been enacted in clinical practice. Although the BTRU was originally funded with £5 million, through the other studies that it's managed to secure, it's actually managed to raise a further £18 million on top of its original award. And that's what a lot of infrastructures try to do. They try to take their own funding and then try to acquire even more funding to do more research on these important issues. And the BTRU was reviewed in 2019. And the conclusion of that review is that it was really doing research that was at the forefront worldwide. For research quality and impact, it was rated as 9 out of 10, and for relevance, 4.75 out of 5. So it's really doing pioneering research. The BTRU, and this was really interesting. I think I can see Irene Salisbury on the photograph in the bottom right. But apart from that work it's doing on transplantation research and grafts, etc., it's got a real strong emphasis on engaging with patients and with the public, and it arranges a number of events and reaches out so that members of the public can understand what it does and why it does it, and why it's really important to build public trust around the issues of transplantation. And like the ARC, the BTRU is also involved in trying to train clinicians and scientists to do the kind of transplant activity and the research around transplant activity to try to kind of build this pipeline for the future. So then I'm going to move on to the Clinical Research Network, and this is often called the CRN. And if you're in our region, sometimes it's called an LCRN, which just means a local clinical research network. This is quite a big infrastructure, and again it's one of 15 around the country. So there's an LCRN in every region around England, and you can see the names of all the different LCRNs at the side, and they get something like £300 million every year. And the main thing that clinical research networks are trying to do is to support the delivery of National Institute for Health Research across both health and social care, but to really drive forward not just the fact that research can happen in the NHS and social care, but also the recruitment of patients into high quality and important studies. And our CRN, our local one, is funded at the moment till 2024. It works with 11 trusts, hospital trusts, and 8 clinical commissioning groups, and it supports 30 different specialities in these hospitals and clinical commissioning groups. It's got about 800 full-time equivalent staff in the LCRN, and in a typical year, it supports about 800 studies. In 2014, or since 2014, over 300,000 people were recruited into research. But I think there's something I really wanted to point out with our LCRN and all the clinical research networks. Since the COVID pandemic, they've very much been at the forefront of trying to move forward the trials on vaccines. So I mentioned that when the vaccines were first developed, there was a need to do very, very small studies to make sure they were safe on volunteers, through into bigger and bigger trials to make sure that these vaccines work. And they're also safe for use across countries and across the world. And our LCRN has been very much at the forefront of that. And over the last year, 2,200 people have been recruited into vaccine trials in this region alone. And Slightly linked to the CRM, we've got a patient recruitment centre. This was established by Newcastle Hospital Foundation Trust, and it's based at the general site, the Campus for Aging and Vitality. It's a centre that's set up to help to deliver the larger clinical trials on that pathway, the ones that involve many more people, where the therapies are really being tested on much bigger groups. And often research participants find themselves invited to participate in studies through clinics and hospitals. So when you go to a hospital, you might be given information about studies and asked if you would like to participate. But sometimes people who've got the kind of chronic longer term conditions that are managed in general practice, or where people are managing by themselves at home, they might miss the opportunity to be involved in research and to be involved in studies that might help develop therapies and approaches for more common and long-term conditions. So the Patient Research Recruitment Centre, or the PRC, tries to reach out to people with long-term conditions who may be in the community, and tries to enable them to participate in research. And that's really helped to drive forward research in some of the kind of common conditions that can get overlooked in trials, things like headaches or asthma or irritable bowel syndrome or some mental health conditions. So that's the place where the PRCs really try to reach out and get the widest participation possible from across communities. There are a number of things called clinical research facilities, and you'll see there's a bit of a theme where Newcastle University and the Newcastle University Hospitals Trust are doing a lot of partnership working. And here what they're trying to do is make the facilities in the hospital sit really close to people with skills and knowledge from the university, so that you can actually bring together both the science and the research and the clinical sort of context. And we've got 3 locations where we have a clinical research facility, one in the RVI and one in the dental school, and one that's over on the general site. And each of these units have got staff that are able to set up trials and help these trials run, but they've also got really kind of close locational working with clinicians who include doctors and nurses and all the specialists in the NHS. And this is just a little bit of information about the clinical aging research unit over in the Campus for Aging and Vitality, and that's focusing on a lot of the conditions around later life, including degenerative conditions. And over on the general site, there's some very specialist equipment which helps researchers and clinicians think about gait, which is how we walk and how we move and how our muscles and bones all work together. But they've also got specialist equipment to do with visual perception and the ability to do imaging to try to take forward biomarkers, etc. So I'm going to take a little bit of a breath just at the moment, just in case there are any questions that have arisen. I can't see any, but I realise that there are a lot of these infrastructures that have all got initials or acronyms, and I'm explaining each one, but I'll bring it all back together at the end. So in the absence of any questions, I'll just touch now on something that's a little bit more university focused, and that's a clinical trials unit. And this is a group of people who are interested in how do you run these trials. Again, it's easy to think about COVID because it's all in our minds and those vaccine studies. Now, how do you set them up? And how do you recruit the right kinds of people into these trials? How do you make sure that you've got people who come from all different backgrounds and different ages? And then when you find out that some vaccines are safe, how do you know how often to repeat them, or whether you can mix and match AstraZeneca with the Moderna and the other vaccines that are available? So the clinical trials unit is very much involved in trying to make sure that these really important trials are designed properly and that they're run safely and that they report back to all the people that oversee them, so that we can ensure that there's no negative consequences for people who are in these trials. And for those, if you read the newspapers, sometimes when these vaccine trials have been going on, You'll have seen in the papers that sometimes they pause for a minute because one of the participants has been poorly, and what's happened is people have gone to investigate whether the participants are poorly for reasons that would have happened anyway, or whether it's anything about the vaccines or the new therapeutics that has caused that illness that they've reported in. So that just hopefully explains a little bit about the clinical trials unit, but also some of the things that you might see reported in the newspapers about some of these many studies that have been going on in the recent past. So now I'm going to talk about something called the MIC. It's easier to use a shorter name, and this is something I've only learned about quite recently. And this is an infrastructure that's interested in devices, but how do we diagnose things? So again, back to COVID, how are we able to know who had COVID or who might have had the antibodies after an experience of COVID, or what the results of those lateral flow tests all mean? And this is where something like the MIC, or the Medical Technology and In Vitro Diagnostics Cooperative, is supposed to do. They're developing all the sort of screening and the diagnostic tools that help you understand whether people have got an illness or a condition, or how severe it might be, or who doesn't have that illness and that condition. And I think there's a bit of a theme arising for the National Institute for Health Research. There's a network of MICs around England. There's 8 of these. All of these 8 were funded by NIHR till 2022 in the current round, and they are linking universities with hospitals and trying to make sure that we can diagnose things quickly and safely and accurately. And I think the last year has really brought this home to everybody, because I've certainly got one of my youngsters doing A-level tests today, and he's had to report on his lateral flow tests about his COVID status on a regular basis over the last few weeks. And this has been unprecedented, the way that some of these tests have been rolled out into communities. And so the MICs are involved in trying to think about the whole of the care pathway, not just people who might have an illness at the beginning of a health journey, but people who might need repeated testing for things. They're interested in how much it costs for these tests and whether they're accurate enough for the cost of them to be able to be economically justifiable. They're looking at all the new tests that are coming along and trying to see which ones are best, which are most accurate, which ones are easy to use or well accepted or tolerated. And our MIC's got 3 key themes, which are about infectious disease. Again, COVID is one there, aging, and personalised medicine. Now, something a little bit different. It is a kind of like whistle-stop tour. We also have in our region something called the National Institute for Health Research Innovation Observatory, and there's only one of these in England, and we have it here in Newcastle. So this Innovation Observatory, or NIRIO, is funded till March 2024. I think it's had about £24 million worth of funding in its big envelope. And it's meant to be a unit that's trying to kind of look out and see what's coming on the horizon. It's using a variety of different techniques to try and do what's called horizon scanning. It's looking forward in time, trying to see the new devices and technologies and challenges for health and care systems, so that we're able to start to think about how we prioritize research and how we prioritize developing testing and therapeutics on these issues. So it's really very, very much an N of one. It's the only one in the country, and its job is to really try to look into the future using all the tools that it can get its hands on, including scraping intelligence off the internet, of all things, and working with NICE and working with a lot of other organisations. The Innovation Observatory has got a strong focus on medicines, and it's trying to see not just what medicines have we got now, but what's in the pipeline for the future. What will be the new medicines that will be needed in 2 years or 5 years' time? Will we have to adapt our COVID vaccine as we get different variants springing up, and how will we know about that? So that's why this is quite an important infrastructure. It's thinking about the devices and the diagnostics. So it's got quite a strong relationship with the MIC that I've just mentioned. It does try to make sure that it reaches out to members of the public to make sure that their views about technologies are taken account of when we're thinking about new and future devices and medicines and technologies. But at the same time, the Innovation Observatory also reaches out into industry, where you've got people who are developing new products and devices and apps and all these things. So it's kind of looking in both directions, both into communities and also into industries, trying to see if it can actually just keep its eye on the horizon and what we need to look out for in our future. There's a strong focus on digital things and information technology and artificial intelligence, because that's how information is moving around increasing at the moment. And it's also got a strong focus on finding evidence, both in the way that researchers in universities do, but also using things called text mining and data analytics. It's sort of bits of technology to try and go and find the information that they would need to use. So from the Innovation Observatory to the Research Design Service, and we sometimes call this the RDS, and there's its contact details. I think you can see, actually, if I just go back one slide, again, I'm showing you a map of England. There are research design services in every bit of England, and we have our RDS up here in the North East and North Cumbria, and it covers the whole of our region. And it's really in place and funded to try to support people to design studies and find funding for studies. And it's mainly involved in helping people find funding from external funding panels where there's a competitive process. So it helps people who've got ideas about studies. It helps them put their questions in a slightly stronger or tighter way. It helps with design. It helps people find method experts to help them with what they might need. So if you're a GP and you've got a research question, but you don't know how to talk to people who know about economics or health economics, the Research Design Service can help link you to statisticians and health economists and trialists and other people like that. It is for people who are long in the tooth like me, and for slightly newer researchers who are just beginning on their research journey. And it helps both practitioners and also people in universities. And it's really trying to make sure that people in our region have got the best support available to them to be able to bring in some of that funding for research into this region to do research on issues that are of relevance to our population. So that's why we have an RDS, to really make sure that research work happens here, so it's relevant to our population and to the challenges that we face here in the North East. And you can see some of the partners that are involved in our research design service, which reaches out to Cumbria and also right down to Teesside. Changing tack slightly, we have something called a School of Public Health Research, and this is often called SPHR. And the School of Public Health Research is something that is national. It happens across England, and our particular version of this was first funded in 2012 and has been renewed twice. In fact, once it's just recently been re-renewed, I think last month. The school, in each of its 5-year funding rounds, is around about £20 million for its 5 years. It's going to go up a little bit. And these are partnerships of academic centres. These are both universities and networks of universities, but right across England. So a school is sort of a national infrastructure with a base in the North East, but it also works very closely with Cambridge, Bristol, Imperial, Liverpool and Lancaster, and Sheffield and other places in London. So it's very much a national thing. Our School of Public Health Research is trying to build an evidence base to inform public health practice. And it's got a number of priority areas or themes. Our School of Public Health Research is interested in children and young people, like the ARC. It's interested in public mental health, which means how do we prevent people from developing mental health problems. So how do you actually act early to try and prevent mental health problems from arising? It's interested in places and communities. And there are some cross-cutting areas of interest, which are around inequalities, and particularly the things that we can modify, which we sometimes call inequity. We're interested in systems, how directors of public health do their job with their colleagues in local authorities and within the NHS. And it's very much interested in thinking about how we operate at a whole population level, not just an individual patient level. And many of you might have heard of FUSE, and there's quite a lot of head scratching about FUSE. So we in the Northeast are a member of the National School of Public Health Research, and our membership is through FUSE, which is a network of 5 Northeast universities. So it's a little bit like the ARC, but it has 5 universities and not 6, because it's been going for quite a while longer. And before our region was currently covering the whole of the Northeast and North Cumbria. So FUSE is virtual. There's no real office where FUSE happens. It is a network of these universities that happens very much through cooperation. It's very much interested in translational public health. And when it was first funded by something called the UK CRC, it was very much about trying to build capacity to have more staff able to do public health research. And its funding from the clinical research collaboration has ended, and now the 5 local universities all chip in to make sure that FUSE can carry on in the way that it does, trying to keep our public health community very much knitted together. And this is becoming a new area of focus for the National Institute for Health Research. It's trying to think not just about the NHS, but how do you actually think about public health and social care and wider local authorities that are very much involved in governing and organising our local communities. And that's where a lot of the drivers of our health status come from. And the Public Health Interventions Responsive Studies team is a really new kid on the block, and it's a terrible name. And I apologise, it's not a name of my making. But you can see on the left hand of this slide, FUSE, this network of 5 local universities interested in public health with its practice partners, is a member of one of these things called a FIRST. It was only designated last year, and it's a very experimental scheme. It was first funded for 3 years, but it's been extended for 5. It's got about £1.8 million, and it's trying to support the research needs of local governments. These are our local authorities in which public health directors and their teams and social care leaders all sit. And these FIRSTs are trying to respond to the needs of partners in local authorities and help to develop studies around the questions that they've got. And it's envisaged that each of these FIRSTs with a PH will probably help with about 6 projects over their 3-year lifespan. And there are 4 teams across England, the one led out of the north by my colleague Ashley Adamson, who leads FUSE. But we've got a team down in Bristol, one in the centre of England, and then something focused around London. And I believe that the NIHR is trying to fund at least 1 more of these FIRST teams. So then moving on through the Ps, we've got a couple of policy research units in the Northeast and North Cumbria. And the first one I'm going to mention is the Policy Research Unit on Behavioural Science. And I know that Irene is very much involved in our PRU in behavioural science. And what this is trying to do, the Department of Health and Social Care with NIHR, the National Institute for Health Research, they funded 15 of these policy research units for 5 years, gave them all £5 million. And these units have scientists who work directly with policymakers in central government, really trying to understand what are the issues that our government needs addressing. And in our policy research unit, we're trying to think about how behavioural science can inform high quality care, how what people think and what they do affects demand on health services, looking at questions like, what do people think about having vaccines, or what do people think about wearing masks? And we've got a very, very strong public involvement. And I know that Irene and David Green are very much involved in the governance of this PRU, and making sure that everything we do has public involvement sort of knitted into it. Our PRU in behavioural sciences works alongside colleagues in London, in Warwick, and UCL also in London. We have another policy research unit, which is actually co-led by Manchester and Newcastle. And this is focusing very much on older people and frailty. And it's got partners in Manchester and LSC, which is in London. And the policy research unit on older people and frailty is interested in things like the impact of ageing on populations and population change, how we can help people stay well for longer as they age. It's looking at issues around frailty and having many different conditions all at the same time, and also making sure that we can support people equally right across the population. And I think for time, I'll probably just not spend too much time on this, but the policy research units in general, they're meant to be responsive. So they're meant to sort of listen to what the government wants and provide the answers really quickly to those questions that ministers and civil servants need answering quite quickly. So just as I'm going to finish now with 3 more slides. Everything I've talked up to so far has been funded by the National Institute for Health Research, which is NIHR. There's a couple of things that are funded by NIHR with NHS England / improvement. So that's NHSEI. And I'm just going to mention the Academic Health Sciences Network. This is one of 15 AHSNs around the country. So again, it's that theme that we've got these networks and these infrastructures all across England. The AHSNs were set up in 2013, and each one is meant to serve its region, and it's meant to think about what is needed for to improve population health, but to generate economic growth and to make sure that we engage with businesses, but do that safely so that patients can benefit from innovations that businesses are developing. So the AHSNs, they try and identify and develop and evaluate new technologies and different ways of delivering care in the health and social care system. It leads things like the Patient Safety Collaborative and the Great North Care Record, which is trying to link the NHS and social care records so that we can actually make sure people are supported. And it's also responsible for healthcare. The AHSNs are also focused on trying to build collaborations between the voluntary sector and businesses and patients and universities. So it's a bit of a broker, a bit of a referee in a football match, trying to bring everyone together into one conversation. And it also delivers some national programs for NHS England, NHS Improvement, and the Office for Life Sciences. Apologies for my distraction then, I lost my thread. We also have a relatively newly designated centre called an Academic Health Sciences Centre, and this is both NIHR and NHS England and Improvement coming together to try and provide even more linking up of all the things that are going on in different parts of the country. In Newcastle, we're one of 8 of these academic health sciences centres. And so you might hear the name Newcastle Health Innovation Partners, NHIP, it's sometimes called, and that's just a shorthand for an academic health sciences centre. It's meant to be very much on the life sciences and discovery end of the pathway that I mentioned at the beginning of the talk, but it's also trying to bring the universities and the council and the Mental Health Trust and the AHSN all together in one conversation so we can get a little bit more sense making across many of these different infrastructures. And so this brings me to my very final slide. And I really wanted to come back to this point of what are all these infrastructures for? There are so many of them, and it is a really crowded and it is really quite a complicated landscape. And if I sit in a university and think that, goodness knows how it must be if you're outside the university and the NHS sector to try to make sense of this. So I think it's fair to say that if you were starting at the beginning and going forward, you probably wouldn't design a system that looks like this. But what's happened is over a number of years, these different networks and things have all been funded piece by piece into a sort of a big jigsaw. And there is really a need to try to put that jigsaw together. So it is, I think, a lot more understandable for all the people who are looking in on them. But the infrastructure is really about trying to link up research, trying to make sure that we've got the right evidence to make sure that people are healthy, and that allows people to drive economic growth, and that essentially is trying to make sure that the North East and North Cumbria is a healthy and better place for people to live. And so the whole thing tries to come together in this virtual sort of cycle of, healthy people are able to, essentially be out and be able to drive forward economies. And that also drives forward making this a good and vibrant place to live. But I think it's also important to make sure that we're always mindful about people who are sometimes overlooked. So whilst often in the hospitals or in the clinics, we're obviously trying to support people to make sure that they're healthy and they're well, but they're often very vulnerable groups who are perhaps away from the hospitals, who maybe include homeless groups or multiply disadvantaged groups who sometimes find themselves not represented in some of the research work that we do. And that's a real commitment to the North East and North Cumbria. And I would say that almost every one of those structures that I've mentioned have all got a commitment to trying to address inequality at the same time as driving forward the research and health agenda. So with a deep breath, I'll stop sharing now and see if anybody's got any questions after that whistle stop tour.